edition of Let's Talk Teeth Live. We're here at University Dental Professionals with our hygiene team, Tania and
Allie, hello.
Minus a couple, Celia and Gwen could not be here.
they're somewhere. I'm sure they'll show up.
They might pop in at some point.
So I'm so excited today. If you guys have any hygiene questions while we're talking, please feel free to put them in the comments below. If we can't answer them while we're live, we'll answer them definitely afterwards. Hygiene is so important. Oral hygiene is so important. So I'm gonna let them get started, and we're gonna start asking a couple questions here. So, what are the advances that you guys are excited about that has happened in hygiene?
Advances. I just think that there's definitely more recognition now that oral hygiene and overall health are not separate entities and that they're tied together. So I would say advances in terms of oral cancer screenings, which we do here. This is a Velscope Lite. It's an advanced oral cancer screening tool. It is used to detect any cell changes in the mouth that we cannot visually see during our oral cancer screening check that we do at each visit. So we like to do this annually for patients who are at higher risk for oral cancer. We use this more frequently, about every 3 months when they come in. So I think this is an excellent tool, especially with HPV being on the rise. It's not just smokers anymore that are at risk for oral cancer. It's not just drinkers. It's younger people now. Oral cancer is affecting younger people because of HPV. So this is an excellent tool, I would say, for sure.
Great advancement.
What about you, Allie?
I personally like using other adjunctives, as in brushing, flossing is great, but also using a mouthwash. We carry the OraCare here. It's a great tool to use. What we do with the OraCare, it's a 2-pump activation system. So you pump one, pump the other, and it actually deoxygenates the bad bacteria in the oral cavity. We have plenty of bacteria, but it takes away the bad bacteria and giving us the optimal oral health care here.
And we have Celia joining us in our
Celia!
She was working hard. Thanks for joining us, Celia. We were talking about the advancements in hygiene and the hygiene technology that we now have, and things that make your job easier. And Tania was talking about the oral cancer screenings we do with Velscope. We did a video on that once. And Allie was discussing all of the fun, nifty things she gets to use with doing hygiene. What about you, Celia? What are you excited about? What excites you with hygiene?
What excites me about hygiene is a challenge. And I learned that from Gwen. So when we come across a patient and we've done some protocols or procedures on them and it's not working, then we try to figure something else out. Something that I do like to do is the oral DNA test. So we'll have patients come in and they can't use a mouthwash like OraCare for 2 weeks prior, or they can't use our probiotics, and they can't use the perio gel for about 2 weeks prior, because we want to get a good DNA sample. So we'll have them swish around saline for about 30 seconds and spit it out, and we'll actually send it to a lab, and the lab will check the microorganisms in it, and then they'll come back to us and let us know which antibiotic that they can use systemically to help them from inside out too.
Yeah, I think that the oral DNA testing is huge in allowing us to really personalize care for our patients, because it allows us to see the pathogenic bacteria and what levels they're at in the mouth. So if they have certain types of more pathogenic or more destructive bacteria in the mouth, obviously that patient's going to require more aggressive treatment. We also do have lasers here in the office, which we absolutely love. The lasers in conjunction with
CO2 laser.
we like diodes too. We have diode laser and CO2 lasers that we use for the hygiene department here, and we love them so much because we just see great success in conjunction with our deeper cleanings, our scaling and root cleaning. We use lasers to help reduce the bacteria in the lining of the gums. And without the laser, the bacteria, it comes back more aggressive and more, I would say, quicker, I would say, because practices that I worked out prior to this, they did not have a laser, and I would feel like I was spinning my wheels in terms of treatment for scaling and root planing, because my patients were, I knew they were clean when they left and they were doing what they should be at home, and then I'd come in and they would have regressed. And so I don't see that as much with the laser. There are, specific cases and instances where if we see breakdown and we can't figure it out like we would do in oral DNA, but lasers are huge. So we love lasers. We use lasers for our deep cleanings, and we also use lasers in conjunction with our perio maintenance appointments, just to reduce that bacteria. Also, if any of our patients are immunocompromised, it's great to use a laser before we actually start the appointment. We have them do a pre-operative rinse with OraCare to reduce the bacteria. Then we would laser them actually before we start the cleaning, just to reduce as much bacteria that would flow through their system as possible. So lasers is huge.
And what I usually tell patients to help have them understand how the laser works is it uses a red light beam, and we put it underneath the gum tissues, and it's touching the gum tissues, and it's pretty much, the bacteria is attracted to that light, and it's pretty much just like zapping that bacteria that's embedded in the gum tissues.
Right.
And there's no discomfort with it at all. It's very easy. Allie just actually used our newest CO2 on me just recently, and it was very comfortable.
Yeah.
So tell us, what is periodontal disease?
Periodontal disease is permanent destruction in the gum tissues and the bone that support the teeth. So your teeth are fused inside your bone, and you have gum tissue surrounding it. So your gum tissue and bone both support your teeth in place. So you need to have good support of it to keep your teeth in place, or they will become mobile, and then you'll lose them.
Right. Doesn't matter how pretty your teeth are if you don't have a solid foundation in your bone and your gums. That's a big thing. So
what's tough about it is that patients don't feel anything majority of the time, so they don't really know if they have it.
A lot of people think that bleeding gums is normal. I would say the majority of my patients that come in think that a little bit of bleeding is normal, but actually healthy gums do not bleed. Healthy gums do not bleed, no matter if you're flossing I guess if you're flossing too hard and brushing too aggressively, you could maybe draw some blood, but overall, I just want to spread the message that healthy gums don't bleed. So,
and it's not normal. If that person says, "Well, that's normal to me," it's not normal.
it's not. There's either something systemically going on that can be contributing to that, or you just need to floss more, brush properly. And I always recommend for home care. I think there's really not any instance where I don't recommend an electric toothbrush. I just think that they clean so much more efficiently. I think everyone would like to brush for 2 minutes a day, but I think the national average is maybe 20 to 30 seconds. So in reality, and I do have some patients say, well, I just don't have time to use my electric toothbrush. And I tell them that that's why you should use an electric toothbrush, because if you're cutting down the amount of time that you're only brushing for 30 seconds, you want as much power in that 30 seconds as you can to blast that plaque away. So an electric toothbrush and using it properly is really important. This is an Oral-B electric toothbrush, which we love here in the office, and this is also Sonicare. But a lot of people don't realize that you do use these differently, because this round oscillating brush head, there's a different technique that you use to brush with it. So we also want to make sure that, I always ask what type of electric toothbrush you're using if you tell me you're using an electric toothbrush, because we want to just go over technique and make sure that you're doing it efficiently. But also, a nice thick floss is a key to good oral hygiene care. I think everyone loves Glide because it's so easy and so smooth, but really I tell my patients to use as thick of a floss as you can, just to really get in there and scrape the plaque out.
The thicker the floss in diameter, the more surface area you will be able to reach. So some people really like the thin floss because they can go in and out very easily, but it's also very flat, so you're not really getting a lot of the surface of the tooth. So patients who switch to a thicker floss, they may actually start bleeding at first, and it's because they're getting more plaque out.
But if you stick with it and push through that first week of pain, your gums are gonna feel better, for sure.
Yes, and with electric toothbrushes, it's a must. If I can get rid of every manual toothbrush off this planet, I would. I have 3 little kids, they each have their own electric toothbrush.
They're really very important.
Going back onto the electric toothbrush, I have to say the Oral-B one has a sensor pressure. I don't know if anyone's a heavy-handed brusher at all, but it's a wonderful technique to use. I don't know if you can see, it's right inside there. So that means you're putting too much pressure on your tooth there. And usually when you're brushing aggressively, you're kind of irritating that gum tissue, kind of wearing that gum tissue and making it recede. So then you're showing more of that enamel there. And so it's one thing that we always say, brush softly.
Yeah, brushing
Not aggressively.
softly for more time is key. So it doesn't benefit you to scrub harder and brush for less time. It's really spending more time brushing softly and just removing those layers of biofilm slowly.
So if I haven't been in like 2 years and I just want to come in and get my teeth whitened, that's all I want, what would you tell me?
Well, we're huge on comprehensive care here in the office, and so it wouldn't be safe. Legally, we can't do that. We need to provide comprehensive care. So if it's been 2 years since you've been seen, you definitely need to come in for a comprehensive exam where we do an oral cancer screening, we do a gum exam, we take images just to make sure that you don't have any cavities, any decay in any of the teeth, because if you were to come in and we were just to whiten your teeth for you and you did have any cavities, your mouth would feel like it was on fire. So you don't want to whiten teeth that have cavities, and then they would be extremely sensitive. But
we want to make sure that patients are safe to get their teeth whitened. We want to make sure that they're healthy, and if there's any problems that they don't feel, we need to address if there are any there.
yes, for sure. And then you can whiten.
Yeah, ultimately, we want to make sure your gums are nice and stable, because if you whiten and then your gums aren't stable and your teeth aren't stable and there's mobility, then there's no point in whitening if you're going to lose all your teeth.
Right.
Or if there's a lot of buildup too. You usually want to get your teeth whitened right after cleaning when it's the cleanest and free from stain. If you have stain in your teeth, then the whitening is not going to be able to penetrate that. One thing I also want to talk about with the electric toothbrushes is a lot of people don't know too, is that these bristles, when you're looking at them, they should look like they're brand new all the time. If your bristles are flared, that means you're brushing way too hard.
You've had it way too long.
Or
both.
Correct.
How often should they be changing their brush head?
Every 3 months you want to change your toothbrush head. So you can mark on your calendar, or what you can do is you can look at it at eye level. And usually they have a light blue indicating strip, and at the very top, once it starts to get a little white and it goes down about 1 millimeter, that's when you really want to replace it.
Great point.
How do you clean your brush head? What do you suggest?
So I just suggest just rinsing it underneath water and then just putting it back on to let it air dry.
Yeah, air drying it for sure. You want to make sure that the bristles, that you're not keeping the bristles in water or anything like that. You want to let them air dry because you don't want any bacteria sitting in there. And if it's wet all the time, that can attract bacteria.
And if you're sick, like if you have strep throat, then you definitely want to change it
A
afterwards.
virus, if you have a cold sore, anything like that, canker sore in the mouth, or if you've been sick at all, change your brush head on your toothbrush.
Now, cold sores, can you laser those off?
We cannot laser them off, but we can laser the cold sore so that it heals quicker.
Got it.
We would use our CO2 laser for that, and yeah, we can help speed up the healing time.
Awesome.
I have a handful of patients that do get them on a regular basis, and when they do get them, they really like the laser because it really does promote quicker healing, and they're not feeling uncomfortable as long.
If you guys could give one great hygiene tip to the world, what would it be?
We just gave so many.
I know, you did. You really, really did.
I would say to try to go in on regular visits as much as possible. If you have insurance, great. Definitely use it. If you don't have dental insurance, try to get in when you can for your, even if you can get in once a year for your checkup and your cleaning. But cleanings are very important. The hygienist can also take a look and see if there's any other dental issues that maybe the dentist needs to come in and take a look at. But cleanings are very important.
And they're very important to stay on track with that because the bacteria, we all kind of have like a threshold where your immune system is fighting off the bacteria all the time. So if you are immunocompromised at any point, if it's flu season, you get the flu or you get a cold, anything like that it causes your immune system to take a dive. And the bacteria in the mouth, unfortunately, is opportunistic. So it will take advantage of your immune system being compromised, and it can cause gingivitis, which is a bacterial infection in the gums. It's reversible. It can cause periodontitis if it's not treated. So coming in the interval time that we recommend is, it really, there's a scientific reason behind it. It's because it gets to a point where the bacteria starts to take over and win the battle versus your immune system. So coming in once every couple of years you're going to have issues when you come in. So preventatively, the more frequently you can come in, just keeping your regular appointments, it really is important.
Also, the bacteria in your mouth can travel into your bloodstream and can cause problems systemically as well. So if you're not taking care of yourself, or if you have uncontrolled diabetes, it could really progress the unhealthiness of your teeth as well, and your bone in your mouth.
I would say that was an excellent, great, you guys, last tip. So thank you to Nia, Allie, and Celia for joining us on this episode of Let's Talk Teeth. I think these were really great tips for the public, for people to know. And come in for your hygiene appointment. If you want to see any of the hygienists here at University Dental Professionals, we're at 773-684-5702, or just simply put a comment below you'd like to schedule an appointment, and one of our front team members will give you a call back to schedule. Thank you guys so much.
Thanks.
Bye, you guys. Have a great day.